welcome to Health Issues. Your host, Chris Sylvain. Truly excited about this show. You know, we're always talking about health. We're talking about nutrition, but we're talking about the things that kill folk. And we have an awesome guest. I'm talking about a great surgeon, a great physician here. Right back to the city, Dr. Albert Sam. How you, Doctor?
Hey, it's good to see you. Thanks for having us.
No, excited to have you. Believe me, your area of study, your area of medicine, I think it's critical in this day and time. Let's talk a little bit about yourself. You're a vascular surgeon. What is that?
That's correct. A vascular surgeon, and really the term surgeon is a misnomer. About 60 to 80% of what I do is non-surgical.
Wow.
But essentially what we do is we treat the vascular system.
Okay.
And there are other physicians that try to treat the vascular system, and they do a good job in their own right.
Okay.
But we're the only physicians that can treat the vascular system medically, surgically, or from an interventional standpoint.
Okay.
And so that's essentially what I do. My field has evolved over the years. It's a relatively young specialty. It was begun in the early 1980s. It used to be a part of general surgery and heart surgery,
right,
but it became so specialized, not only from the pharmacological standpoints, being drugs and medicines that we give,
right,
to surgeries that we do that have become more complex. It eventually morphed into its own specialty in the mid to late 80s. And so that's what I do. Essentially, all I do is deal with blood vessels that can become diseased, that are not in the heart, because that's what cardiologists do. Or heart surgeons, or blood vessels that are actually in the brain. That's what neuroradiologists do.
Wow.
So essentially blockages in the neck. Almost half of all strokes are caused by blockages here.
Wow.
Blockages in the abdomen, which can lead to poor circulation, or aneurysm formation that can rupture and cause death.
Really?
In fact, aneurysm rupture is the third leading cause of sudden death in men over 65.
Really?
And blockages in the legs. Blockages in the legs is the leading cause of amputations in our country. The highest amputation rate by the Medicare database is Louisiana. And the highest pocket of people who require amputations are in the South Louisiana corridor between New Orleans and Baton Rouge, where the rate is about 5 times the national average. So obviously there's plenty of disease here to treat, which is why I'm here in New Orleans.
Fantastic. And you're right at Tulane University's teach at the School of Medicine and practice the whole bit. You're chief of vascular surgery over there.
That's correct. I've been named the chief of vascular and endovascular surgery at Tulane Medical School, and I took that position approximately a month and a half ago.
Hey, welcome.
It's good to be here.
Right out of Brother Martin, Tulane, right. Morehouse man, Renaissance man.
That's right, yeah. I'm a proud Morehouse man, our HBCUs, I'm proud to say. And then I left there and went to Duke University for my medical school training. And after that I went to Chicago, where I did 9 years of training. I did my general surgery at the University of Illinois. I did a 2-year research fellowship there and did a master's in physiology at that time point. After that, I went to Northwestern across town and did my vascular fellowship, because that's how you become a subspecialist. So I did that for 2 years, did aneurysm research there, and then took a job in Baton Rouge in 2003. I was in private practice for 10 years before I became the chief at Tulane.
Awesome, awesome. Well, let's deal with the stuff.
Sure.
This concept, like you said. So it's vascular surgery or whatever, vascular care. The neck and the abdomen and the legs.
That's correct.
All right, everywhere else or whatever. So what's going on in there? We call it, what's happening? The vasculature is, that's the blood vessels themselves.
That's right. Blood vessels essentially like highways. There are 2 types of blood vessels. You have arteries, and then you have veins. People don't usually break them out that way. In fact, I ask patients all the time, what's the difference between an artery and a vein? And they say one is deep and one is close to the skin, and that's close. But for the most part, they're both blood vessels, but they have very different functions. Arteries carry blood from the heart to the rest of the body. Whereas veins, they take the blood the arteries have pumped to the other parts of the body, and they transport the blood back to the heart. So there are a whole array of diseases that can happen in the arteries, which are very different than the diseases that can happen in the veins.
Really?
Right. The arterial diseases are sexy diseases. Those are the ones that get all the attention. But for every 1 person that has a disease of the arteries, you have about 6 people walking around with diseases of the veins. Really? But it's just that venous problems are not as impactful to your life or your limb or your well-being as arterial diseases.
Okay.
So essentially, that's the difference between the two. They're both blood vessels,
right,
but they do very different things. It's like having two highways. You have I-10 and I-12.
Right.
They're both highways, right?
Right.
But they'll take you different places.
All right, hey, curiosity. Let's talk about the venous issues, and let's talk about the arterial issues.
Sure. For the most part, like I said, for every one person with arterial problems, you have 6 people with venous problems.
Okay, varicose veins, that's one of them.
Varicose veins.
The big billboards all over right now that for $150 or whatever it is, I don't know, maybe, I probably have it confused, but you can get your varicose veins removed.
That's right. Varicose veins usually underlies a more deeper structural problems with the veins. Remember, the veins will transport the blood from the legs back to the heart.
Okay.
And most of the time, that's going to be a process that occurs against gravity.
Okay.
Because most of the time you're standing or sitting upright. In order for that to happen, you have to have the valves inside the vein open and close in a way that lets blood go up, but prevents blood from coming back down.
Against gravity.
Right.
The blood has to fly back up to the heart.
Because when you contract your muscles in your legs, it squeezes on the veins, which pushes the blood up.
Okay.
But then when those muscles relax again, the blood wants to fall right back down with gravity.
Okay.
That's when those valves should close. Very common, 25% of all women, 12% of all men, that valve system fails. And so you get a lot of blood that pools in the lower legs. And then you have basically too much blood in your legs. And that can be a problem. It can cause pain, discomfort, because the veins get too big. They press on nerves, which are next to the veins. It can cause like a toothache of the vein, like an aching, throbbing sensation, usually after a long day of work.
Wow.
And then when you prop your feet up, it helps things feel better, because it eases the flow of that blood back to the heart.
Okay.
Over long periods of time, the blood cells break down, and the pigment that carries the oxygen begins to get into the soft tissues.
Okay.
Once blood gets into the soft tissues, it's an irritant, and it can cause darkening of the skin, usually inside by the ankle, which can become an ulceration. Once it becomes an ulceration, it's really hard to treat at that point. So we like to treat you before that. And we have some techniques that are pretty good in treating it before it reaches that point.
So that's the guy with the billboards.
Those are the people with the billboards, but we can do it best at Tulane.
It's good stuff.
Yeah.
All right. So that's one of those with the vein issues. But the heart, like you say, you call that the sexy issues.
Yeah.
That's the big heart attack.
Right. So people can live with venous problems and do okay, and you never know it.
Okay.
When you have arterial problems, that's when you lose your legs. That's when you lose your life. That's when you lose function because of strokes. So that's why it gets much more attention. The way vascular disease occurs of the arteries, there are 5 essential causes. There's high blood pressure, diabetes, high cholesterol, there's smoking, okay? And also there's just family history. Some families are genetically predisposed to have all these problems.
Wow, New Orleans.
Right, and so if we talk about New Orleans, and in a more global aspect, we can talk about the stroke belt. So the southeastern United States has a much higher incidence of, say, one of the peripheral vascular disease types that results in stroke. Why? A couple of reasons. Number one, obviously our lifestyle. Our lifestyle is about what? Overindulgence. It's about
Le bon temps roulé.
Yeah, exactly. I wish I could say it as eloquently as you, but I can't.
It's on TV.
So we tend to overeat, and we tend to overeat on most of the things that we shouldn't overeat with. We tend to lead a sedentary life, as Southerners do. Why is that? Number one, it's hot. You know, this is not Vermont. This is not Washington State. It's hot outside. So we're less likely to be able to do things year-round outdoors. Number three, we're less likely to be well educated in the southeastern part of the country. Because of our educational system, there's a direct inverse correlation. The worse educated you are, the more likely you're going to have vascular problems. Why is that? If you're less educated, you're more likely to smoke. If you're less educated, you're more likely to not know the importance of exercise. If you're less educated, you're more likely to eat things that taste good, but you just don't realize that they're not good for you. So all those things work against us in the South. Plus, in the southeastern corridor of the United States, we're more likely to be black or brown. Black and brown people have higher incidences of all the diseases, high blood pressure, diabetes, and all that, which eventually results in having arterial problems. So a lot of things are working against us in the South.
So this is 5 times the national average as far as for people contracting the disease and eventually dying from it.
Well, that figure is not for all of the South. Okay. The African Americans, black folks, us, we have a much higher incidence, say a 5-time incidence of having arterial disease that may result in leg amputations than others. Okay. Our stroke risk is maybe twice as high. Okay, our risk, but conversely, we have lower incidences of other disease processes. For instance, the vascular disease that can cause aneurysm rupture is much lower in the black communities than it is in other communities. So that's one of the things that being brown or black can kind of be somewhat protective against. Okay.
Genetic, or is just more of our lifestyle?
And that's the reason. When we talk about aneurysm disease, that's mostly a genetically predisposed thing that we see mostly in older white individuals, less likely in black individuals. But if you have a higher incidence of having diabetes, high blood pressure, that then leads you to have a higher incidence of the diseases that can cause stroke and limb loss.
All right. So let's talk about this vessel here.
Sure.
And what's going on? What you said it's not a clot. You talked about that earlier. It's not a clot. It's not like it just gets clogged up like a drain pipe.
No. When you use the term clots, and a lot of people do, that's different than what happens in the arteries. Clots typically happen in veins. Oh, so we talked initially about venous problems.
Right.
So if you have venous problems, too much blood in your veins, the valves don't work, it increases the chances that the blood will clot abnormally in those veins and cause what we call a deep vein thrombosis, say DVT.
All right.
That's typically what we refer to as when we're saying clots, okay? Why is that important? That's important because, you know, they're actually very common in our country. If you go in any hospital, fully a quarter of all people in any hospitals are going to have some evidence of clot in the deep veins. Okay. In fact, the complications from those clots breaking off and going to the lungs kills more people every year than breast cancer or AIDS combined, because they're so common and so prevalent. Okay. So when we speak of clots, that's what we're speaking about. In the artery, that's in the veins. In the arteries, we're talking about plaque.
Okay.
Clots develop fairly quickly. For instance, commonly a young man, car accident, long bone fracture, gets the long bone fixed, going home, all of a sudden they die, leaving the hospital, okay? Because the injury in the immobilized leg, the veins weren't being pumped like they normally would. Clot developed in the vein, broke off and traveled to the lung. Not trying to scare your audience or anything, but essentially that's a clot. Happens suddenly. Whereas a plaque happens over time.
Okay.
Plaques happen over many years of bad behavior, we like to say. Many years of not keeping your blood pressure under control. Many years of not controlling your diet and thus becoming diabetic. Many years of smoking. You know, many years of not watching your cholesterol. Okay, that process starts actually in the youth. We've been able to show that even young kids now who are developing type 2 diabetes because they're overweight can have precursor changes in their blood vessels, which down the road we know is going to be a vessel that's going to have plaque develop and thus get you on my operating room table.
So you can even look at little kids now and check inside that vessel.
Sure.
And see what will we see in the vessel.
Sure. Well, what are the things we talked about that predispose you? Poor diets, poor behaviors, and a lack of exercise.
Okay.
Kids now, their diets are much worse than we were children.
Right.
They're less active than when we were kids.
Right.
You know, and that's not all their fault. I have children. You try to get their video game out of their hands and tell them to go outside and play. You know, it's almost impossible.
Right.
Plus, it's hotter now than it used to be.
Yeah.
Okay.
That's right. Okay.
Okay. I used to be able to play forever and not get burned.
That's a good point.
Kids now, you go outside, you get burned.
That's a good point.
So, I mean, there's so many things working against children today being active.
Yeah. Keep them inside.
And when you're not active, you gain weight.
Okay.
You don't. Your cholesterol becomes kind of deranged because activity increases that good cholesterol, which prevents plaque from developing.
Okay.
And so, if you're less active, those things don't happen. So that's why we can see those changes even in children.
Even in children. So the
early changes.
Early changes.
Not advanced changes.
So it's not actually plaque per se.
No. But you can begin to see the damage in the blood vessels that eventually will become a plaque that will cause blockage of a vessel.
New question though. Is there a test, say like I have a 15-year-old, and I say, kid, your blood pressure's fine, your cholesterol, everything's good, all your numbers are good, but I believe you have something in your vessels that aren't right. Is there any way to test them without going into that vessel?
No, there really isn't. There's no low blood test you can get. There's nothing quick and simple. But for the most part, it would be almost unheard of to have a kid have clinically significant vascular disease.
Okay.
And the need and cost to develop a test to see if that kid is at risk for developing disease down the road, really it's not something we need to do, because we can look at that kid's family history. Okay. We can look at that kid's behaviors. All right. And we can almost predict with some certainty if they're on the road to developing diseases.
So the 14 and 15-year-old diabetics that we find coming out with type 2 diabetes, we can almost be assured that, in other words, we can look at their diet and look at their lifestyle. We don't need to, they can't go in with an angiogram or whatever at a 13-year-old. That wouldn't even make sense.
No.
But we can tell them, hey kid, if you're eating burgers and fries every day and you're sitting at home, there's something going on in your vessel that's going to pop up later. Instead
of, with this generation now, if we don't kind of change things, instead of having these problems happen in your 60s and 50s and 60s, they're going to start to happen in the 40s. And that would be a shame. It would be.
Wow. So let's kind of let's walk everybody through. All right, sitting at home using a remote, not running and eating the sugar, fat, salt, and grease. So what's going on in that vessel? It starts with a streak first.
Sure, exactly.
And what is that?
Usually the first thing that's laid down in the inside of the blood vessel is like a fatty streak.
Okay.
You have excess circulating cholesterols. You may have excess what we call free radicals from high sugar, high fructose diets. All of those contribute to cause little damages in the inner lining of the blood vessel wall called the endothelium.
Got it.
Once the endothelium, or the inner lining of the blood vessel, is damaged, well, then the body kicks in to repair that damage. So the first thing that happens is cells begin to coalesce, meaning gather around the damaged blood vessel. Once cells start to kind of coalesce around the damaged area of the blood vessel, it attracts other chemicals there, and eventually you get a reaction whose end result is calcium deposition. Inflammation almost anywhere in the body eventually leads to calcium formation. And then once that calcium begins to deposit in that wall, that's when you get the inside of the wall of the blood vessel getting narrow and narrow and narrow. And that's when you get blockage to wherever organ that blood vessel feeds down to.
And the blood has to go through. Now, question now, you speak about inflammation. When we think about inflammation, if I cut my hand, it's going to swell up and a lot of pus and everything. Is that the same thing going on the inside of the vessel?
No, that's infection. So there's inflammation and then there's infection.
Gotcha.
So when you have an infection, thank goodness we have inflammation, because the inflammatory process helps fight the infection.
Gotcha.
But there's inflammation without infection. And that's what happens in vascular disease. When you have the things that predispose you to have vascular problems, too much sugar in your blood vessels, toxins from cigarette smokes, high blood pressure where the heart is pounding hard, pushing blood way too hard against lining of blood vessels such that the blood vessel lining kind of comes apart, damages, and then the body tries to fix it. That's an inflammatory process that tries to repair that. And the end result of all this inflammation that occurs in blood vessels, it typically is plaque deposition, calcium deposition. Once you get that, the blood vessel begins to narrow.
it narrows, and we got to get to this. I hope everybody's excited as I am. High blood pressure, because people don't take their medicine. Sure. They're like, forget this. I could care less what my pressure is. Unless I have a headache, right, I'm not taking medicine when my pressure's high. But what you're saying is that even though there are no symptoms and the pressure's high, that what's going on now is pounding again.
Right. Because it's those blood cells, red blood cells, are being forced into blood vessels at a part per square inch pressure rate higher than what it should be. Okay. The heart has to pump harder because the blood vessels are less elastic than what they should be. Mm-hmm. And when the blood vessels become less willing to relax and receive a red blood cell, it kind of fights it. And then eventually something has to give. And what gives is the cells that line the inner blood vessel kind of come apart from each other because they should be well connected. Right. But if you're getting bombarded with red blood cells coming at these connections at a force that's higher than what it should be, eventually these tight connections become looser connections. Okay. And then once you get looser connections, it starts a cascade of inflammation where the body's trying to repair this. And that eventually ends up to being hardening of the arteries.
I mean, we've looked at some studies where, particularly in some neighborhoods, over 40, like 70% of the people, 80% of the people over 40 have high blood pressure. Right. You know, in some neighborhoods, and nobody's controlled. Right. You know, forget it, because there's no headaches and there's no problem. Silent killer. So the damage is going on the inside of the body in those vessel walls.
Yeah, and it's happening continuous with each beat of the heart. So that's why we always preach blood pressure control. You know, and a lot of what we do essentially, and we talked about education. A lot of what we do as vascular professionals is educating people, because most people think that there's nothing you can do about whether or not you're going to get vascular disease. Right. You know, it's in my genes. Right. You know, we talked backstage about stroke. You know, how many people in our community, especially culturally, think, you know, if Big Mama had a stroke, you know, or Papa had a stroke, you know, it's because he had an aneurysm. Right. Well, the reality is, Chris, as you know, is that rarely do we die of strokes caused by aneurysms. Most of those strokes are caused by blood pressure that's out of whack. Blockages in the neck that have come from smoking or diabetes or other things that inherently could have been prevented. Oftentimes, there were signs and symptoms before you had that stroke, such as tingling of the fingertips. Right. Inability to use the arm for a short period of time. Right. Visual changes, like someone's pulled a curtain over your eye. Slurring of speech. Okay. Usually all those things predispose before you have a stroke a lot of times. So no, you know, Big Mama didn't die of an aneurysm in the brain. Right. She died because her diabetes was never under control. She never took her blood pressure pills. She was probably 50 pounds too heavy, you know, and didn't exercise.
Most of the people who die in Louisiana, disease-wise, I guess, young folks is gunshots, but for the most part, like you said, just dealing with those clots, venous clots, is more than AIDS and breast cancer, and that's the ones that scare people. But we're dealing with vascular diseases, cardiovascular disease.
No, I like throwing that little figure out there because it gets people's attention with venous disease. Yeah. But the reality is, when it comes to the overall rankings and the cause of death, you know, AIDS, breast cancer, you know, venous pulmonary emboli, they're essentially not that significant when you look at the main causes of death, such as cancer, pulmonary diseases, and stroke. Stroke's the fourth leading cause of death. Right. Coronary disease, heart disease, the second leading cause of death. Coronary disease, heart disease, leading cause of death. Third leading cause of death is lung disease. You know, COPD, fourth leading cause of death is stroke. So, you know, AIDS, blood pressure, breast cancer, and all those, they're very low on the risk. But coronary and peripheral vascular disease are very high in the top 5.
Would you say that?
And cancer being number 2. I forgot to say that.
Yeah, but the cardiovascular disease or whatever is way higher than cancer if we line them up.
No, cancer's number 2.
Number 2?
Yeah, heart disease number 1, cancer number 2. Okay. Pulmonary disease is number 3. All right. Stroke number 4. Okay. And stroke used to be number 3 until recently.
Interesting. Question then though, is all cardiovascular diseases preventable?
Not all. but the significant portion. You have some people who just no matter what have the genes that are responsible for deranged blood vessels, okay?
Okay.
Have the genes that code for aneurysm formation.
Okay.
Okay. That's not the vast majority of people who keep me up and at work every day.
Say out of 100 people, any figures just to throw them around
sure,
or whatever?
Less than 2.
Less than 2?
Less than 2.
So rarely
right.
are we dealing with somebody who, okay, there's nothing they can do about it.
Exactly.
So these things are for the most part preventable.
Yes. Inherently preventable, and can almost always be attributed back to how you've cared for yourself and your habits.
Interesting. We're about to close, and we dealt with high blood pressure, but we want to deal with diabetes.
Sure.
The pressures, again, is separating those cells or whatever, and it's creating that problem. But sugar in the blood.
Mm-hmm. Sugar in the blood is inherently not a good thing. The excess sugar deposits in a different layer in the blood cell called the basement membrane, which is more of a reinforcement membrane in our blood vessels.
Okay.
And like I said, our blood vessels need to be very pliable. Okay? Mm-hmm. They need to be able to relax and constrict. Once you begin to get thickening of the blood vessels as a result of, say, sugar deposition over a long period of time, they get stiff. Right. And you no longer have that ability to kind of have the blood vessel relax. They also become less responsive to different hormonal type substances in the bloodstream, not the endothelium cell, which is the inner lining that they produce. Right. Because relaxation and constriction doesn't just happen. There are substances that are secreted to make that happen. Okay. Once the sugars begin to damage and thicken these walls, it prevents all the reactivity from those medications and substances from happening. In addition, when you have excess sugar in the blood, it causes free radicals to be of excess in the blood. Free radicals are basically charged molecules, you know, with either a positive or negative charge, which tends to damage the surface of a blood vessel. Wow. When you get damage in the surface of an inner lining of a blood vessel, that's when you start the cascade of inflammation that can lead to blockage formation. So
we have the control.
We have all of the control.
Major. We're about to close. Any special points you think that the audience needs to understand, just to sum it up?
Sure. At the end of the day, education is the key to all these problems. All right. If we can just do certain small changes in what we do in our lives, we can make big changes that will affect all of us individually, but also as a nation, we'll be much healthier, and as a community, we'll be more productive. But it all starts with what we decide to make changes with.
Dr. Sam, I think this is awesome. I'm excited. Again, this is Health Issues. Chris Sylvain, your host. You can catch us on the web, healthissues2010.org. Hey, be a preacher and tell everybody how important it is. Keep your blood pressure under control. Keep your blood sugar under control. But you have the control. Don't blame it on mama and daddy. You can make a difference. Thank you. Fight as hard as you can. Appreciate you.